Next, we have clinical essentials.
I know about these.
What do you know about these?
These are the 50, or if you ask me, 51 topics that we focus on as quality, that we really want to make sure are requirements for our hospital for the safety of our patients. I like to say there's 51 because I like to include the dental radiography.
That's a good one.
PPE stands for personal protective equipment, which in the hospital setting is extremely important. It includes things like gloves, gowns, masks, foot coverings, things that provide a physical barrier of safety for our associates as it relates to different things like infectious diseases.
We could play a PPE or not game right now.
We could.
All right, let's go.
could.
Rapid fire, go.
Eye shields.
Yes. Face mask.
Yes.
Gloves.
Yes.
Sunglasses.
No.
Why not?
Necktie.
No.
There you go.
There you go.
You ready for the next one?
Sure.
5 domains of quality.
Oh, this one I might actually know about. So the 5 domains of quality are the different areas that we kind of use as a general guideline for assessing the quality of our care. So is it pet and client centered? Is it timely? Is it efficient? Is it effective? And is it safe? That one should probably go first.
Safe?
Yeah, safe.
Yeah.
Safe is
I
probably
mean, that's a personal fave since I do oversee OSHA, but yes,
yeah.
yes, yes.
So safe.
No, I would agree with that. Yeah.
Is that like where you see like a particularly amorous public display of affection, you know, like public display of super affection or something like that?
Close, but
Close?
no. Okay. Well, not even close.
All right, PDSA. Public display super affection?
It is, exactly.
Like this?
Yeah.
What does it mean?
So this is...
I'm sure it has something to do with quality.
It does. So
Yes.
this is what we do in our project work. So it's a cycle that we use: plan, do, study, act. So first is we plan the project. The second is we do it. Then we study the results from it to make sure that it's working the way we want it to. And then we act on that based on the results that we get.
These are just your typical patient safety events. Let's make sure that we keep up on these because this is the best way to learn and grow in our hospital and just take advantage of situations that could be a near miss or something that we feel that it could be a learning opportunity.
I remember those. I think some of our clinical essentials actually came from patient safety events.
That's right.
Stopping the line for us is really around whenever we see an incident, right, that could have adverse events or adverse impacts to the patient, the well-being of our patients, well-being of our associates, and well-being of our clients.
Sure.
And we take a moment to stop and reflect and take action to either alleviate the risk, stop the risk from happening, and then coming together as a team to correct and move forward in the right direction.
So our next concept, Lorna, is culturally competent care.
Oh, okay. I'm curious. I don't know what that is.
So that means that it is our responsibility to ensure that we work with every associate, every client, every pet in a way that makes sense to them. So we need to be sensitive about their individual needs because of their individual characteristics, whether it's the language that they speak, the socioeconomic background that they have, the country that they were raised in. Because if we don't understand what they need, we can't provide them the care and their pets won't be happy and healthy.